Did you know that for a chiropractor, the adjustment is the easiest thing to do? Let me tell you what the hardest thing to do is: the diagnosis. A chiropractor can very easily get away with saying, hey, your headache is coming from a C5, C6 problem, and I just give an adjustment, or maybe I go to the x-rays, like you guys know what I do with the x-rays, to direct the misalignment in a specific fashion, to align it properly and stuff like that. It's because we don't just anyhow crack the spine, we readjust, and we really are specific about it. You guys know that that is the art of chiropractic that I hone so well, but that still isn't the biggest joy that patients receive. Patients receive the most joy in my clinic here when they know that they received a diagnosis that they never expected from a doctor. Here's why. Chiropractors like myself, who specialize in orthopedics, who specialize in neuromusculoskeletal disease, including chronic pain, specialize in diagnosing the condition. That means actually functioning as a doctor, which means to teach, and be a diagnostician to go look at the available evidence in the literature, in the research, and going, okay, person A has a headache in the eye, right? There's pain and has an aura, has some kind of nausea, vomiting, dizziness. You know, what does this likely show that the patient has? And then going into orthopedic testing, further clinical testing that is, and figuring out, hey, so-and-so, this is your likely diagnosis, this is the appropriate treatment that we're gonna give you. Now, let's take x-rays, let's use a nervous scope, find the segment that needs to be adjusted, and then looking at the x-rays to adjust the spine in a specific way. Now, that kind of procedure is what gives the patient the full confidence that I know what I'm talking about. Not the adjustment only, not the x-rays only, not the treatment in and of itself. It is what happens before the treatment, and that is the diagnosis stage. So I want to ask you this question. If you're watching this video and you're maybe a little bit uncertain about getting chiropractic care, or uncertain about getting spinal care for that matter, do you have a diagnostician in mind that you know is really, really good? Perhaps a heart surgeon or some ENT doctor, like really skilled with diagnosing skills, right? That is where you would need to find a neuromusculoskeletal specialist who can do the same. So if you're suffering chronic pain, chronic disease, and you've never had spinal healing before, I want to avail myself to you. I want to put myself on that platform to say that as a neuromusculoskeletal specialist, your chronic pain will be properly diagnosed and then properly treated. I hope this gives you clarity. Thank you.